Today, we're going to talk about challenges and possible complications having a bariatric surgery. Hello, I'm Grant, and I'm trying to live forever. Today, we're going to talk about some possible challenges and complications that might happen having had a bariatric surgery, like a gastric sleeve or a gastric bypass. All right, so everybody knows there are some complications: bleeding, leaking, infection from having a surgery. Yes, that possibility is there. But the biggest possibility that is nothing's going to happen. By the numbers, you're more apt to have a complication from a hip or knee replacement surgery or a shoulder replacement surgery or any kind of surgery like that. The odds are better with a gastric bypass than with a regular surgery that you hear about day to day. They have got this down so cold. They have got the system down, made up so well. They have specialized tools. They do it day in and day out. They have got every angle figured out. It's a very, very safe procedure, okay? But there's always those outliers, okay? There's always those small things that might happen. And it happens with everybody, not just the bariatric community, okay? So just, the chances of something bad happen are very low. Okay, the next thing, because of you're having a surgery, you have to pay attention to is possible blood clots. Okay, there's a reason they put those little boots on you when you're in the surgery, when you're on the table getting the surgery done and getting all that blood moving so that blood doesn't pool in your legs and the clot doesn't produce, because a blood clot is a serious situation, okay? Blood clot, if you have one, if they find it and they get it out of you, that's okay. But if a blood clot that's not seen and gets through your bloodstream into your lungs, that's lights out, baby. Even in the hospital, your recovery rate from that one is really low. So that is the main reason why as soon as you can, they get you up out of bed and get you walking, because that moves the blood. Walking is the natural pump of your body. Okay, not running, not bicycling, walking is your natural pump. It helps you get the anesthesia out while you're in the hospital, since you've been there. It helps with the blood clots and gets things moving and gets things the way it should be. Okay? You need to walk every day. Every day, especially after the first day after surgery. From that point on, the rest of your life, you need to walk every day. I walk every day. Every day. And I'm 53 years old now, just had a birthday. Okay, so if I don't walk, I get sore, I hurt. When I get up in the morning, I'm older now. When I get up in the morning, I'm stiff. But when I get, my teeth brushed and my shake done and I'm at the office, I exercise at my office. When I get there, when I'm walking, that first 10 minutes I'm walking funny because I'm still stiff and sore from the night before sleeping, and I start loosening up, and from 10 to 20 minutes I'm starting to feel really good. Things are moving, I'm loosened up. By the time I hit that 30 minutes and I'm done, I could go all day. And I can tell the days that I don't walk how I feel. It's so very important. You have to get up. And I'm not talking about a fast walk, a power walker. I'm talking about strolling. It's your natural pump. It fixes everything. Walking is the wonder drug, okay? Walk. Now, to go along with the walking, Now, you've just had a surgery and you've rearranged your plumbing, right? You have a new pouch or you have a new sleeve. You've got to take it easy on the NSAIDs. The non-steroidal, the Aleve, the Tylenols, the ibuprofens, you got to get them out of your life. Okay, because the reason is this, is because they will raise the rate of you creating an ulcer in your new pouch by 5 to 10% if you use them on a regular basis. I stay as far away from them as I possibly can. Now, they're still in the cupboard. I had COVID recently, about a month ago, and trust me, when you're not on them all the time and all of a sudden you start taking them, they work great. They do a good job. But if you take them every day, you are dramatically raising the possibility of you creating an ulcer in your new pouch or your small intestine past your pouch. So if you can, stay off the NSAIDs. All right? Please stay off the NSAIDs. They're bad. Now, the next thing, this is mainly for you sleeve people. You're going to have reflux. The vast majority of you that have this surgery are going to have reflux. It's just part of it. You are going to have it. Just plan on it. Talk to your doctor. They will have something figured out. They'll have a medication. They'll have something they can give you. Just know going in, reflux is going to be a bear. It's going to be terrible. And just talk to your doctor about it. Brings me to the next thing. Talking to your doctor. Okay. Every doctor that does your surgery should give you paperwork or a card with a list of symptoms on it. Okay, of things to watch for at least the first 2 weeks. And these are signs of infections or problems. Okay, so, and there'll be a list, and that's the main thing. You have to be careful because you have a fresh surgery. You have fresh incisions. You have, there's going to be inflammation. There's going to be pain. You're going to be sore. Your body is going to be trying to, recover from a surgery without any calories. Okay? So have that doctor's number in your phone. Have it on speed dial. If you think there's a problem, call. Okay? Call. Don't get on the internet and start asking questions on the internet. Please don't do that. Okay, in the first 2 weeks, if you have a problem, if you think there's a problem, if you get a hangnail, if you get, I don't care what it is, call your doctor. Don't get on the internet. Okay? Everybody got an opinion on the internet. That's not medical. They're not medically trained. Everybody has a different result. So if you think there's a problem, call your doctor. All right? Okay, so we're done with all the possibilities, okay, and what to do if you possibly think there's something wrong. And so just know all of that going in, all right? Now, the one thing that people don't really talk a lot about is that you're going to be vitamin deficient for the first 3 months. And the reason is this, is that with the inflammation, with the recovery, with the lack of space, with the stomach that's this big, if you're an ounce and a half, if you're a gastric bypass person, or a 2 ounce little banana sleeve, if you're a sleeve patient, you just ain't gonna have room. And the other thing is that your system is just not gonna like them. It's just not. Now, I worked around it as best I could for the first 3 months back in my day. And I went to GNC and I tried to find everything I could in the liquid form. And I used that in my shake that took me all day to drink. But I did try to get my B vitamins and my B complexes and stuff like that in liquid form. They used to call it sublingual, under the tongue. But I would put that in the shake because putting it on the tongue, it made me sick. So I put it in my shake. They're all about shakes these days. So if you can add them in and stomach them, but you're probably going to be pretty deficient because I can guarantee you're already deficient. You might be eating a ton of food, but you're going to be malnourished. Your vitamin levels are going to be shit because you're not paying attention to it right now. Until the day you wake up from the surgery, then you're going to have to start paying attention to it. But you're going to have a hard time for the first 3 months. But it does get better. It does get better. After that first 3 months, in what I call the golden era, that 3 months to 12 months, everything starts working again. And you start being able to eat a little bit more. Your stomach will get used to the vitamins. Everything will start working again. And then you start getting blood work and you start working, adding this and deleting that and seeing what you are and aren't deficient in. So you can work it that way. But that first 3 months, you're going to have a hard time. All right. And the last one is for you ladies. I don't know why it is. Maybe it's because we're wired a little different. Maybe it's a estrogen testosterone thing. But guys usually don't have this much of a problem. Okay, so when you wake up from the surgery, the day after your surgery, you've just lost your best friend. And what I mean by that is most women have an emotional attachment to food. Men do too, but we handle it different. We're taught not to cry, all that, la, 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 when we're kids, be a man, rub dirt on it, you'll be okay. Okay, guys handle this emotionally better. But women, you ladies, I'm sorry to say, I love you all, but your best friend had just got medically removed from you. Okay? And you're going to be looking for other places to find that comfort that you always got from food. That comfort is gone. And sometimes it manifests in other bad habits. Sometimes it manifests in drug use. Sometimes it manifests in alcohol abuse and other different things. But you can not have that happen. There are support groups. There is overeating support groups. There is websites. There is the church is a great resource. Counseling is a great resource. Most insurances now will pay for a specific amount of counseling. They are now getting into where they consider the mental aspect along with the physical aspect, okay? Because it's emotional and mental just as much as it is physical. You've had a fix in your brain when you eat, that comfort, and it's going to be gone. And you're going to be mad and short with people and aggravated, and you're going to want to scream at God. You're going to wonder, what did I do to myself? Because a large part of your emotional stability has just been removed. But there are resources. There are people out there to help. There are people out there to talk to. But the main thing that with the counseling that I found when my wife used it after a bad period in her life, that bad thing happened, it was just having someone to listen. Someone you didn't have any emotional attachment to just sit and listen and let you get it out. That sometimes is the biggest part of just feeling comfortable enough to let it out. Because once you get it out, sometimes it's just like this huge weight that just, I can't believe I just said that. But I feel so much better just to get it out. Just to get it out there on the table and just look at it and go, why was that messing with me so bad? I'm hoping you all the best of luck. And I hope all of you have great surgeries and have great results and do great. So like, share, and subscribe. I'm proud of every one of you. Y'all have a great day, because a great day today could mean an even better day tomorrow. Y'all be good.